Good.
Lovely. Well, I'm here today with Dr. Grant Stevens, and Dr. Stevens is the president of the American Society for Aesthetic Plastic Surgery.
Good job, Trish.
It's only a constant away, but anyway. And he's also the professor of plastic surgery at the University of Southern California. And I'm honoured and privileged to be here today to talk to Dr. Stevens about the Hydrafacial treatment, which is a bit of an unsung hero, I think, in the industry. So thank you so much for joining us today.
You're welcome.
Lovely.
It's my pleasure to be here.
Thank you so much.
Here at Gold Coast here in
I
Australia,
know.
speaking for everybody here at the Non-Surgical Symposium.
Nice and warm. Not that it's not warm where you are, but
Yeah, it feels a lot like my home, actually.
Yeah, totally great.
Yeah.
So I want to ask you, so we've heard of some clinics replacing other devices and treatments with the Hydrafacial. So, but what is it about the Hydrafacial that you and clinics and patients love?
Well, thank you very much for the opportunity to be here. I've had Hydrafacial actually for 5 years, and recently we've changed it and upgraded it, and I have a number of clinics throughout Southern California where we have 2 and 3 Hydrafacials at each clinic. At my main office in Marina Del Rey, California, I have 3, and as I mentioned, I've had them for 4 to 5 years. Now, why do I like Hydrafacial? Number 1, it's great for all skin types. Number 2, there's no downtime whatsoever. I get them every other month. You can do it all skin types, colors, dry, moist, oily, and so forth, because they're individualized, as you're going to hear. No downtime, and it's a way to package together the 3 parts of a facial that include cleansing, then extracting or microdermabrasion if you are extracting, and then infusing or actually putting something into the skin, all in one 20 to 30 minute procedure. My estheticians occasionally will do dermaplaning in addition to that, but that's not necessarily, that's not part of the Hydrafacial, but so my estheticians like to do the dermaplaning at the same time. There are multiple Hydrafacials throughout the world. It's all over America, and not just in doctors' offices, but in medical spas and health clubs and throughout. What I like is the consistency that it offers. If a person sits down to have Hydrafacial, they have the whole thing, and I know in my patient's case that their skin is basically in the best shape that it can be at that moment.
Yeah, and I suppose it's a great prep for anyone who's actually having any surgical work as well, because you kind of want your skin to be in tip-top
So I'm glad you
shape.
brought that up, because when I have facelifts, I'm a plastic surgeon, as you know, and so I want my patient's skin to be in the best shape possible, because I'm going to look better when they look better.
Yeah.
And so whenever I sign someone up for any surgery of the face, I send them down for a Hydrafacial, because I say the barnacles off. I want to have that skin the healthiest it can be, and I start them on something called elastin. Now, elastin is not necessarily part of Hydrafacial. However, I mentioned the infusate. Hydrafacial has coupled up with elastin and their trihexpeptide, and soon, in the next few months, we will have the elastin trihexpeptide in addition to the Hydrafacial, and they will infuse the elastin into the skin. I start all my patients on Hydrafacial and elastin as a home-based product, and soon it'll start in the office with the Hydrafacial.
Right, and that way you're strengthening the skin as well.
Yes, so it changes the extracellular matrix, which is a fancy word, but it really means it's the area between the cells. If you're a cell and I'm a cell, the area between us is called the extracellular matrix. It's what's going on between you and me. And that's collagen and elastin. It determines the turgor of the skin, the elasticity of the skin, and basically how healthy the skin looks and feels. Now, elastin with the trihexpeptide goes into this space between us. It gets rid of the old collagen, gets rid of the old elastin, and makes new collagen, new elastin. Now, if Hydrafacial drives that in and gets it deeper right off the bat, my patients get a jump start. I've had the ability to use this, which is coming to Australia.
Yeah.
I've been able to use it in Marina Del Rey at my Orange Twist Institute, and I've seen the results. I will tell you also, it's on my skin right now.
Okay.
I don't
Pretty
have a
good
day.
skin.
I don't have a day that I don't have the trihexpeptide on my skin
Right.
for over 2 years, and my skin is in much better shape. Feel how smooth my skin is. Yeah, feel how smooth my forehead is. It's unbelievable. Not bad for 65, right?
pretty good.
So, this trihex peptide is
Yeah.
amazing, and with the Hydrafacial to smooth it and prepare it for anything. Now, we use this also when we're going to do lasers or microneedling or microneedling with RF.
Yeah.
And I have my patients on a Hydrafacial regimen.
Yeah.
So they come in every month,
Yeah.
just like you might come in for anything else,
Yep.
a service, and then we get their skin ready and keep it optimized even after the procedure.
Yeah.
So we'll couple it with Vivace, which is a microneedling and RF, or any number of things, Profound, any number of things that we do.
Well, it's funny because, like, out of all of all the presentations I've been watching, it's so important. No matter what you haven't done, the skin quality is really important. And I think what you said is right. People need to be on a program where you commit to your Hydrafacial, but you just got to do it as a regular thing. It's part of maintenance.
It's what we do in other things,
Yeah.
right? We brush our teeth every day.
Exactly.
There's
Yeah.
all sorts of things we do part of maintenance and
Yeah.
good health.
Yeah.
And let's face it, the skin is our paint job.
Yeah.
If a car had an accident, you get all the dents out.
Yeah.
You wouldn't think of not painting it if
No,
it were
exactly.
right. This is our paint job. So we work on all this other stuff, but why not work on our paint job and the quality of our skin?
Yeah.
Because it really is what we're projecting.
Yeah, totally. So I want to ask you something else. So
Yeah.
I know you kind of explained that, but so the Hydrafacial, so how does it work? So it's like a couple of, like the first thing that you do, like what's the first thing?
First thing you do is you come in and you lie down.
Okay,
And the
easy.
esthetician
Yeah.
starts treating your skin. First thing she or he does is cleanse the skin. This is all part of the Hydrafacial.
Yeah.
So they cleanse the skin because you want to have a clean palate, right?
Yeah.
So once it's clean, then they exfoliate and extract and they clean and they basically take the old dead bad stuff off.
Yeah. And
Right?
it's all done with this little,
A diamond tip.
Yeah.
They have different tips
Yeah.
in a controlled, very predictable fashion, as I mentioned, with all skin types, with no downtime.
Yeah.
Now, once that's done, I call it the buff because I call it the buff and puff.
Yeah.
But once it's buffed out,
Yeah.
then they infuse various substances, and they have hyaluronic acid, they have glycolic acid, they have the ZO products for clarifying. I mentioned the elastin that's coming shortly. So this infusion actually pushes it into our skin. And so the active ingredients are actually delivered to our cells and the extracellular matrix.
And I've noticed that when people come out of a Hydrafacial, like you've got this, like a glow, it's sort of got this,
Yes,
I don't know, there's something.
it's like a glow, and I
What's
get
that?
one every month to 2 months.
Okay.
I'm thinking of jumping up on the table here at the show because I noticed they have one here, and I thought, well, why not get one?
Yeah, totally.
Maybe we'll go from here and go do it.
Yeah,
You can
totally.
film it.
Yeah, I will. Good
I
idea.
love it, and
Good
there is a
idea.
glow.
Yeah, oh, absolutely. I've definitely noticed it. You can see when someone's had a Hydrafacial. So another thing I was going to ask you is, how many Hydrafacial treatments do you think a patient needs before they start to notice a different, because
I get asked that all the time.
Yeah.
You see a difference the first time,
Yeah.
but after 2 or 3, you're hooked, and you're coming every month.
Yeah.
Or every 2 months
Yeah.
at the most.
And it feels great, because I've
Oh.
had it, and it just feels amazing on your skin. There's no doubt about it.
Yeah.
Right.
Remember the buff and puff?
Yes.
That's
yes.
what I call it in my
The buff
office.
and
That's
puff.
not a Hydrafacial word.
I'm going to.
I'm sure they'd kill me if they said it, but no, I love it.
Yeah, awesome. The last question I was going to ask you, why would someone want to choose Hydrafacial over, say, another treatment? Like how do you say it would compare to skin needling or laser or?
Well, there we're comparing, a bicycle and an automobile.
Yeah.
They're all about skin, but they're complementary. So Hydrafacial and microneedling, they have nothing in common except
Yeah.
it's skin. I mean, you prep the skin for microneedling with Hydrafacial.
Yeah.
You mentioned laser, same thing. I might do Hydrafacial, needling, and laser.
Yeah.
Depending on because laser isn't one thing. Are we
Yeah.
talking about to get the brown spots, to get the red spots,
So true, yeah.
for smoothing?
Yeah.
So you can't really compare them. They complement each other.
Yeah.
Does that make sense?
Yeah, it
They're
does.
not
It
competitive.
does. No.
They're not competitive at all.
Yeah.
So we routinely get people on a Hydrafacial every month or two. Then they come in for microneedling 2 or 3 times. They might come in for a halo or a BBL.
Yeah.
Once a year, or BBL is actually 3 or 4 times a year.
Yeah.
But the ongoing theme here is Hydrafacial,
Yeah.
because the Hydrafacial gives you the best skin of your life, day to day to day to day to day, and then you might put in microneedling, you might put in laser. Does that make sense?
Yeah, totally. And I think as well, like not that the microneedling and the RF is invasive, because they're all non-invasive, but the Hydrafacial is a relaxing nice, like it's not going to hurt.
No.
You're going to come out looking good. So it's kind of like just that top level, look after yourself.
Right.
Yeah.
Absolutely.
Oh, awesome.
So maybe what we can do when we're done here, we go down to the booth and I can jump up and have a Hydrafacial.
That's a great idea.
I'm talking about it, and right now I'm thinking I haven't had one for about 6 weeks. I'm really starting to have that need. It's like crack for me.
Yeah.
And I need to go get my fix.
Yeah,
So maybe we can go from here and go and get
do
my
it.
fix.
Let's do it.
Before I go on stage to do my next
Perfect.
talk.
Great idea. Well, thank you so much for taking
You're
the
welcome.
time to talk.
Thank you for having me.
So,
Shake my hand
thank
here.
you. Thank you. So, listeners, if you're out there and you're wanting to have a full Hydrafacial treatment, they are everywhere in Australia. And they're also everywhere in the US, obviously. If you don't know where to find someone, just drop us an email to info@plasticsurgeryhelp.com.au, or otherwise just Google it. Thank you so much.
You're very welcome.